بسم الله الرحمن الرحيم، والصلاة والسلام على أشرف خلق الله محمد بن عبد الله الصادق الأمين. أما بعد، السلام عليكم ورحمة الله وبركاته. عنوان المحاضرة Guided Endodontic Repair Practical Aspects, presented by me دكتور نشان محمد, an endodontic specialist. عنوان المحاضرة مقصود يكون Guided Endodontic Repair لأن احنا حنتكلم اليوم. موضوع المحاضرة هو Endodontic Regeneration أو pulp revascularization أو pulp revitalization. تعمدت يكون الاسم Guided Endodontic Repair علشان أوضح أن هناك جدل على التسمية نفسها وكل له سببه. pulp revascularization الاسم يوحي بأنه يحصل وهذا حقيقة، يعني يحصل growth لنيو blood vessels، لكن ما يحدث برضو أيضا فيه غير ال blood vessels cells neural elements و cellular elements و other hard tissues. So it's not only pulp revascularization. Pulp revitalization means the pulp regains its vitality. Okay, but vitality is a broader than just a response to cold test or to different clinical tests. So we are not sure if it is only revitalization or it is vital because of the response to cold test. Endodontic regeneration means that we regain the highly vascularized, delicate connective tissue, the vascular, neural, cellular element of the pulp space. It's not that it doesn't hold the meaning of regeneration. So guided endodontic repair, yeah, there is a healing, there is a repair process. It comprises the cellular, blood vessels, cellular elements, neural elements, and thus I like this term, guided endodontic repair. So today we are discussing pulpal necrosis in an immature teeth, the teeth that has an incompletely formed root. What causes a pulp necrosis of an incompletely developed tooth are three causes: trauma, dental anomalies, and caries. Discussing the etiology behind the pulpal necrosis of an immature teeth is beyond the scope of this lecture, but we can talk briefly that trauma cases are more prevalent. They are around 35% of the pulpal necrosis caused by trauma. It's more prevalent from age 7 to 15 years. At this age, most of the teeth are having incomplete roots. Dental anomalies also, like dens invaginatus and dens evaginatus, are common, around 36%. Discussing these types of anomalies is beyond the scope of this lecture, but to talk briefly that dens evaginatus is almost 23% of the cases, followed by dens invaginatus around 2%. The tooth has the channels that communicate between oral environment and the pulpal space, which may lead to pulpal infection and pulpal necrosis. Regenerative endodontic procedures in these cases have different outcomes. The last cause is caries. Caries is the most common oral disease. I think maybe after periodontitis, the most common disease. I don't know which is more prevalent, the period diseases or the caries, but still is more common. بسبب انه في اسباب متعددة للبلبل نيكروسيس. هناك ايضا السكسس ريت يختلف باختلاف هذا السبب. حالات التروما قد تكون في حالات السيفير injuries زي الانتروجنز والافالجن have a lower success rates than shallower trauma. Trauma may cause root fractures or microfractures that may interfere with healing and will affect success. Care is also the composition of the care is may differ in composition and extension and the persistence of the biofilms, and thus compromise the success rate. This is a radiograph of an incompletely formed root, a tooth that has blunderbuss root. These tooth cannot be treated conventionally because we cannot guarantee a periapical seal. We cannot achieve an adequate sealing during conventional endodontic therapy because of the anatomy of the root. This tooth is weak. This tooth may get lost because of another trauma, or might fracture cervically because the dentine is very thin, and we cannot also extract this tooth because extraction has its consequences. Extraction leads to loss of function, altered maxillary and mandibular bone development. Extraction interfere with phonetics, breathing, and mastication. Also a psychological trauma to the patient with a missing tooth or teeth. We cannot extract and place implants also because implants are contraindicated in patients undergoing cranioskeletal development, as their use has been associated with interferences in normal orofacial growth. Higital 2006. So we cannot treat conventionally. We cannot extract and leave it as it is, and we cannot extract and replace by implant. What to do? Traditionally, before we discuss what we can do or what can we do, let's review traditionally what have been used to treat such cases. Calcium hydroxide detoxification was a solution for these cases. Calcium hydroxide detoxification has a success rate of 95%, but calcium hydroxide detoxification has its own limitations. A patient complained from the number of visits. Calcium hydroxide detoxification take up to 3 years for dentin bridge to form. In between the commencement of the treatment and the formation of this dentin bridge, a patient keep going and coming to our clinics to replace calcium hydroxide, and this is maybe a source of patient complaint. Longer duration, take up to 3 years. Calcium hydroxide decreases mechanical properties of dentin due to the prolonged contact. As we said, calcium hydroxide, we keep replacing calcium hydroxide for up to 3 years. This prolonged contact with dentin may lead to decrease the mechanical properties of dentin. The most disadvantage of calcium hydroxide detoxification is it doesn't promote root development. So, a study evaluating root fractures after evixification procedures in 885 luxated non-vital incisors clearly demonstrated that as low as 28% and as high as 77% of the teeth had cervical root fractures, where the arrow is indicating, owing to the least amount of dentin present in this area. This area specifically needs to have dentin formation. We will discuss it in a later slide. The other solution is MTA evixification, which has success rate around 94%. Its advantage over calcium hydroxide evixification is we can restore the tooth immediately at the same visit as of MTA evixification. It has also its own limitation. It doesn't promote continued root development. Before we start to discuss the procedures of endodontic guided repair, we can have a look at this classification for the stages of root development, because in a recent preclinical study found that vascularized tissue could be formed in teeth with an apical diameter of approximately 0.3 millimeter, which is similar to the apical diameter of most canals in fully mature roots. Yes, there is a lot of case reports. They started a regenerative endodontic procedures or a guided endodontic repair in a fully mature roots. It was thought that regenerative endodontic procedures should be limited to stages maybe from 3 to 4 or 5, but now any stage can be treated uh, using regenerative endodontic procedures. So, what's the component of regenerative endodontic procedures? There are three components: disinfection, recruitment of mesenchymal stem cells, and establishment of a scaffold, placement of a coronary barrier, and restoration. Disinfection. We know the importance of disinfection in endodontics in general. Eliminating microbial biofilms is of paramount importance in any endodontic procedures. In reps, disinfection also sets the stage for a stem cell conducive environment. يعني في البداية أو زمان أو في الconventional root canal treatment كان يعنينا إن الاريجنت أو disinfectant agent يقتل البكتيريا, kill الميكروب, disinfect the root canal system, and that's it. Now, we all know the the requirement for an ideal irrigant solution, but in regenerative endodontic procedures it sets the bar a little bit higher, لأنه نحتاج an irrigant that not only kill the bacteria but also try to provide an environment that is conducive to the mesenchymal stem cells growth, proliferation and differentiation. Mesenchymal stem cells from the periapical tissue such as the apical papilla and the periodontal ligament are recruited into the root canal system and are thought to mediate the regenerative processes. Because a variety of factors affect stem cell survival and differentiation, it's crucial to pay close attention to the exogenous materials that are introduced into the canal system for this infection, as well as pre-existing biofilms. This is a slide showing the most prevalent, most common irrigants and intracanal medications used in regenerative procedures. In terms of irrigants, we have sodium hypochlorite, chlorhexidine, ADTA, MTAD, MTAD. Calcium hydroxide is an intracanal medicament which is used commonly, triple antibiotic paste, double antibiotic paste, and formocresol. As we said, the irrigant should not only kill bacteria but should be conducive to mesenchymal stem cells growth, proliferation, and differentiation. Sodium hypochlorite at higher concentration may have a cytotoxic effect on those mesenchymal stem cells, and thus American Association of Endodontists recommends the use of 2.5%. EDTA found to have a great effect on the growth factors of that are very important to growth factors and signaling molecules that are very important to chemotaxis, differentiation, and angiogenesis, as we will see in a later slide. A recent study by Iranian group showed that chlorhexidine was the most toxic agent or irrigant to the mesenchymal stem cells. Ashri et al. 2016 found that Final drains using 17% EDTA solution before revascularization has positive impact on tissue interaction along dentinal walls without modification of the cell type. يعني ال EDTA مهمة جدا في الزيارة اللي حنحط فيها البايوسيراميك ماتيريال after الريجنراتيف endodontic procedures. Therefore, to accomplish a conducive microenvironment for regeneration while achieving maximal bacterial efficacy, 1.5% sodium hypochlorite followed by 17% ADTA and using either 1 mg per milliliter triple antibiotic paste or double antibiotic paste or calcium hydroxide is recommended. This is a photo showing that in picture number 1, when an irrigant and a medicaments introduced into the root canal system, they have their effect on either a free bioactive molecules, or they expose a bioactive molecules from the dentine matrix. These bioactive molecules, growth factors, or signaling molecules have their chemotaxis effect, angiogenesis, neurogenesis, mineralizing differentiation, as we see in picture number 2. Mesenchymal stem cells from the apical area start to be introduced into the root canal system to be organized, proliferate, and differentiate into odontoblast-like cells and start angiogenesis also and neurogenesis formation. The second component of a regenerative endodontic procedure is recruitment of apical mesenchymal stem cells and establishment of scaffold. Scaffold is a three-dimensional structure that support and hold the proliferation, differentiation of mesenchymal stem cells. Scaffold is a 3D structure that allows stem cells organization, proliferation, and differentiation, and allows cell communication during regenerative procedures. It also allows for a passage of nutrients and waste. Stem cells following evoked bleeding. When we do, as we will see in the steps of the clinical procedures, we evoke bleeding from the periapical area. This step was found that there is a substantial influx of mesenchymal stem cells into root canals during regenerative procedures, resulting in an increase greater than 700-fold in the expression of mesenchymal stem cells markers. يعني الخطوة هذه حنذكرها في الكلينيكال procedures. The third component is placement of a coronal barrier and restoration. The yellow arrow indicates where to the area where to place the bioceramic material, MTA or biodentine, among other bioceramic materials. طبعا MTA, biodentine, Brasseler, Endosequence, all are bioceramic materials. We may talk about them later. These materials have been shown to promote the differentiation of the mesenchymal stem cells into an odontoblast-like phenotype while allowing for enhanced proliferation of mesenchymal stem cells. ليش نحط bioceramic material? Because it's important for the differentiation of mesenchymal stem cells into an odontoblast-like phenotype, وكمان allowing for enhanced proliferation of mesenchymal stem cells. Importantly, they provide safe zone barrier بتخلي زي الفاصل بين coronal restoration, final restoration, and the content of the bulb or the blood clot we placed inside the root canal system. We evoked by bleeding, we do not place. Barrier to the restorative materials to seal the pulp chamber. That's من تعزله عن النوكشيوس stimuli اللي جاي من الفاينل restoration اللي affect the cell survival and differentiation. Interestingly, there have been case reports وبرضه في حالات لم يستخدموا لا MTA ولا bioceramic material وحصل عندهم success rate كويس. potentially leading to the formation of biological coronal seal. Treatment outcomes. Now we after we finish a regenerative endodontic procedures, we look for a treatment outcome. This outcome are of three levels: primary treatment goal, secondary treatment goal, and tertiary treatment goal. The patient-centered outcome may be يعني باختصار الشيء يقصد هنا the primary therapeutic goal of reps must be resolution of apical periodontitis while promoting the survival and function of the tooth. يعني إذا أجى مريض وعنده periapical radiolucency أو عنده signs and symptoms، على الأقل البرايمري outcome إنه يختفي البريبيكال radiolucency، يحصل لها healing، والsigns and symptoms الألم اللي كان جاي فيها المريض اختفى. In 2012, a retrospective study aimed to directly compare the clinical outcomes of apexification and RIPS and regenerative endodontic procedures. This study was the first to compare both procedures performed under standardized protocols and included apexification procedures performed with use of MTA as an apical plug or the long-term use of calcium hydroxide. Resolution of the disease process, no pain, swelling, or sinus tracts, was found in 100% of the regenerative endodontic procedures, while it was 95% for the MTA apexification and 77% of calcium hydroxide apexification. There is a difference between the calcium hydroxide apexification and the regenerative endodontic procedures. On the other hand, another retrospective study that did not include standardization of treatment protocols found regenerative endodontic procedures to promote healing in 79% of patients treated, whereas apexification procedures promoted healing in 100% of the patients. شح الارتكلز والستديز والcomparison between two treatment modalities، لأن واحدة منهم قديمة جدا والثانية تعتبر إلى نوع ما حديثة. لا زال المقارنة بينهم ليست كاملة أو على الوجه الأكمل. In a prospective study, both MTA apexification and regenerative endodontic procedures were found to promote healing in 100% of all patients. تقريبا الفرق بسيط بين ال MTA and regenerative endodontic procedures، لكن في فرق بين الكالسيوم hydroxide apexification and regenerative endodontic procedures. The secondary treatment outcome is a continued root development. Root development is considered a secondary goal of regenerative endodontic procedures because the tooth is weak and fragile and has incomplete root formation. One of the treatment outcomes for regenerative endodontic procedure is the continued root development. The survival rate of conventional endodontic therapy is around for 8 years is around 97% of the cases. As we said, regenerative endodontic procedure is almost a new technique. The survival rate of teeth treated with regenerative endodontic procedures is 100% of the teeth survived, but the follow-up period was only 18 months. But it was significantly greater than that of teeth treated with calcium hydroxide with a 77% survival rate, but now not different from teeth treated with an MTA apical plug, 95%. These findings are in agreement with previous reports that prolonged use of calcium hydroxide can significantly weaken teeth, increasing their susceptibility to fracture. لأنه لما يتكون الروت من ناحية الطول ويزيد thickening of the dentine، أكيد حيصير الروت أقوى وليس عرضة إنه ينكسر، وبالتالي نفقد الأسنان. There is also some reports that teeth treated with revascularization showed significantly greater percentage increase in root length, around 15%, compared with teeth treated by either MTA apexification or calcium hydroxide apexification. وهذه ذكرناها من limitation of MTA apexification or calcium hydroxide apexification. لا ينمو الروت مع الكالسيوم هيدروكسيد والام تي اي بعكس ال regenerative endodontic procedures. They also reported that the revascularization protocol produced significantly greater percentage increase in root width compared with teeth treated by either MTA epixification or calcium hydroxide epixification. يعني بنتكلم على length and width. Ribs or regenerative endodontic procedures are superior to both MTA or calcium hydroxide epixification. Regenerative procedures promoted an average increase of 12% in root thickness and a 50% decrease in apical diameter, apical closure, whereas epixification procedures demonstrated no change during the 18-month observation period. The tertiary treatment outcome is response to vitality testing. Number one was elimination of signs and symptoms, healing of periapical radiolucencies or lesions. The secondary treatment outcome was increase in root length and width. The tertiary outcome or treatment goal is the tooth supposed to respond to vitality testing. Collectively, these findings support the hypothesis that mesenchymal stem cells transferred into the root canal space during regenerative endodontic procedures, as we said. حسب احنا هنستخدم ايش من اريجان زي ما اتفقنا ال ADTA enhance ال bioactivity, it releases growth factors from dentin وبالتالي increase ال chemotaxis, angiogenesis and neurogenesis. So, into the root canal space during regenerative endodontic procedures are likely important in the recruitment of apical primary afferent fibers through a specific mechanism of postnatal axonal targeting. The exact mechanism by which these newly recruited neurons respond to the different stimuli used in vitality testing warrants further investigation. كيف الله أعلم. إنه في المهم إنه في case reports after regenerative endodontic procedures and on application of vitality testing there was a response. The presence of innervation suggests that presence of a vital tissue that is immune competent due to the intimate association of innervation with blood vessels. معنى انه ما في blood vessels الا لما يكون فيه nerve cells, nerve elements, and the immune system. It also suggests the recovery of nociceptions that's crucial for the detection of actual or potential injury to the tooth organ. We are here reaching the clinical protocol and ending our presentation. This is the clinical considerations for a regenerative procedures, which is revised by American Association of Endodontists on 6th of August 2016. This consideration they said that should be seen as one possible source of information, and given the rapid evolving nature of this field, clinicians should also actively review new findings elsewhere as they become available. Anyway, هذه يمكن أهم ما في الكيس برزنتيشن اليوم. clinical protocol حاول أشرحه بالتفصيل بداية من الكيس selection. tooth with necrotic pulp and immature apex، لأن البلب لو كان مش necrotic فمعنى احنا بنتكلم على bulbotomy أو other measures to preserve the vitality and enhance root formation. رقم 2 bulb space not needed for post core and final restoration. You can restore the tooth by direct composite restoration, for example. Complaint of the patient and the parent should be taken in consideration. Patients not allergic to medicaments and antibiotics necessary to complete procedures. ASA 1 or 2 patients. So you have to take an informed consent to the patient. Two or more the treatment will comprise of 2 or more appointments. You will use an antimicrobial. There is a possible adverse effects like staining of a crown or a root, lack of response to treatment, failure of the treatment. That means failure, pain and or infection. Alternatives to regenerative endodontic procedures: still you can make an MTA epixification, still you can do nothing to the patient, and extraction is also a possibility when the tooth has been deemed as non-salvageable. Of course, you can enter the data to the American Association of Endodontists database if you are interested. The first appointment, you have to give local anesthesia. You isolate the tooth and start your access cavity. You will make a copious irrigation with copious and gentle irrigation with sodium hypochlorite in an amount of 20 milli, using an irrigation system that minimizes the possibility of extrusion of irrigants into the periapical space. تستخدم بغزارة بس بطريقة جنتل صوديوم هايبوكلورايد كمية 20 ملي، تركيزه 1.5 ملي. آسف، أنا أول يمكن قلت 2.5 و1.5 1.5% صوديوم هايبوكلورايد. وتستخدم irrigation system that prevent extrusion of the sodium hypochlorite beyond the apex، لأن احنا بنتعامل على immature or possibility of extrusion is very high. يا تستخدم side vented needle، يا تستخدم Endovac system apical negative pressure or negative apical pressure. Lower concentrations of sodium hypochlorite are advised. 1.5% sodium hypochlorite 20 milli per canal for 5 minutes, and then irrigated with saline or EDTA. 20 milli EDTA per canal for 5 minutes with irrigating needle positioned about 1 millimeter from root end. Do not extrude the irrigants beyond the apex to minimize cytotoxicity to stem cells in the apical tissue. Then we will dry canals with paper points, and now we will place the intracanal medication. The latest recommendation are either you can place calcium hydroxide or low concentration of triple antibiotic paste. If the triple antibiotic paste is used, you can first consider sealing pulp chamber with الدنتين bonding agent. هنستخدم bonding agent في البلب chamber عشان نقفل الدنتينال tubules. Why؟ لأن التريبل antibiotic paste فيه مينوسايكلين. مينوسايكلين من عائلة التتراسايكلين، وهم يسووا discoloration. التريبل antibiotic paste هو سيبروفلوكساسين، مترونيدازول، ومينوسايكلين، وحنخلطهم بريشيو 1:1:1. 1 سيبروفلوكساسين، 1 مترونيدازول، 1 مينوسايكلين to a final concentration of 0.1:1 milligram per milliliter. Triple antibiotic paste has been associated with tooth discoloration. If you are afraid of tooth staining أو خايف إنه يحصل تصبغات للأسنان بسبب المينوسايكلين، تشيل المينوسايكلين يبقى لك الدبل antibiotic paste سيبروفلوكساسين and metronidazole. Double antibiotic paste without minocycline paste or substitution of minocycline for other antibiotic, clindamycin, amoxicillin or cefaclor, and in this case will be a modified triple antibiotic paste. Is another possible alternative as root canal disinfectant. يعني رقم 1 anesthesia, rubber dam isolation, start access cavity, irrigate with 1.5% sodium hypochlorite in an amount of 20 milliliter per canal for 5 minutes. You will use a needle with closed end and side vents or an negative apical pressure system like an Endovac. You will have you will be keen not to extrude the irrigant beyond the apex. You will dry the canals and with paper point. After that, you will place either calcium hydroxide. Calcium hydroxide will be put by a Lentulus spiral, paper point, whatever the method you like, or you can use triple antibiotic paste. If you are afraid of tooth discoloration and staining, you can remove the minocycline and use only the double antibiotic paste, ciprofloxacin or metronidazole, or you can replace minocycline with clindamycin, amoxicillin, cefaclor, and in this case will be called modified triple antibiotic paste. Deliver into canal system via syringe the triple antibiotic paste or the double antibiotic paste or the calcium hydroxide. If triple antibiotic is used, ensure that إذا استخدمت المينوسايكلين اعمل دنتين بوندينج ايجنت to seal the dentinal tubules. وكمان اتأكد ان التريبل انتيبيوتيك paste is below the cemento enamel junction عشان لو حصل discoloration ما يكونش كثير او حتى يحصل في جزء بعيد عن الكراون. Seal with 3 to 4 millimeter of temporary restorative materials such as cavite, IRM, glass ionomer or another temporary material. Dismiss patient for 1 to 4 weeks. In the second appointment, 1 to 4 weeks after the first visit, assess response. الآن يجيك المريض في الزيارة الثانية، المفروض إنه signs and symptoms اختفت، sinus tract اختفت، pain اختفى، وبالتالي حنكمل. إذا هذه الأشياء أو أي واحدة منها موجودة حنعيد اللي عملناه في الخطوة السابقة أو في الزيارة الأولى. لو الأمور طيبة no signs and symptoms, no sinus tract, and the tooth is asymptomatic, no pain, you can go to the procedure. هتخدر المريض، هتستخدم 3% ميفيكاين without vasoconstrictor. We will discuss why now. You will isolate the tooth with a rubber dam. You will irrigate copiously but gently with 20 ml of 17% EDTA, and we said why, because EDTA promotes growth factors and increases success rate of regenerative endodontic procedures. Dry with paper points. Create bleeding into canal system by over instrumenting endofile or endo explorer. هتاخد فايل explorer spreader أي sharp instrument size 20 15 size 30 25. Induce هتعدي beyond the apex. Induce by rotating a pre-curved K file أو spreader as we said. Add 2 mm past the apical foramen. فقط 2 ملي بعد الأبيكال foramen with the goal of having the entire canal filled with blood to the level of the cemento enamel junction. هتجيب الفايل هتعدي به 2 ملي فقط beyond the apex وتحاول to initiate bleeding. An alternative to creating of a blood clot is the use of platelet-rich plasma, platelet-rich fibrin اللي هو الجيل الثاني تقريبا أو second generation, or autologous fibrin matrix. احنا حنتكلم تحديدا على بعيد عنهم، ما هماش مهمين لكن ليسوا في هذه المحاضرة. وبالتالي احنا size 15 size 25 spreader أو فايل نعدي فيه بعد الإبكس 2 ملي ونسوي bleeding trauma induce للبليدنج وبنخلي البليدنج يحصل لغاية الأوريفيس. لما induce أو evoke البليدنج لا نعدي أكثر من 2 ملي عشان لا نأذي epithelial root sheath of Hertwig اللي هو المسؤول عن الروت ديفلوبمنت، ولا نسوي circumferential filing بحيث إنه نعمل more damage ونأذي more cells. Stop bleeding at a level that allows for 3 to 4 millimeters of restorative material. Place resorbable matrix. هذه خطوة اختيارية optional. You can place, you cannot. Place a resorbable matrix such as cola plug, cola coat, cola tape over the blood clot if necessary, and white MTA as capping material. A 3 to 4 millimeter layer of glass ionomer Fuji or glass, this is a company, is a glass ionomer, is flowed gently over the capping material and light cured for 40 seconds. MTA has been associated with discoloration زي ما قلنا، حتى الوايت MTA مش فقط الجراي MTA. ممكن نبديل لل MTA يكون البايو سيراميكس زي مين تراي كالسيوم سيليكيت سيمنتس بايودنتين. Should be considered in teeth where there is an aesthetic concern. Anterior and premolar teeth consider the use of cola tape cola plug علشان ما يحصل discoloration و compromise للأesthetic. Consider use of cola tape cola plug and restoring with 3 mm of non-staining restorative material followed by bonding a filled composite to the beveled enamel margin. Molar teeth or teeth with porcelain fused metal crowns, consider use of cola tape cola plug and restoring with 3 mm of MTA followed by resin modified glass ionomer or composite or alloy. Limitation. What's the limitation of regenerative endodontic procedures? Number one, inability to evoke bleeding. But in this, there is a report, case reports. There have been reports of successful regenerative endodontic procedures without the formation of an intracanal blood clot. And to enhance bleeding, in the second visit, we used local anesthesia without vasoconstrictor. Can be used during the second visit followed by laceration of the apical papilla with a hand file or other sharp instrument لأنه لو في فازو كونستريكتور ممكن ما يخليش يحصل bleeding زي الناس. However, care should be employed هنا في حالة evoking لما تأدي بالسبريدر أو بالفايل. Care should be employed to not extend laterally and circumferentially so as to avoid damaging the Hertwig's epithelial root sheath اللي هو في الأخير المايسترو وهو اللي هو responsible عن root formation أو root maturogenesis. This important structure plays a crucial role in dictating root development and shape. In an elegant study complete damage يعني في study لما عملوا damage للهيرتوكس epithelial root sheath, it resulted in no further root development, whereas partial or no damage resulted in smaller blunted roots or normal roots. لما يكون complete damage, no roots, no further root development. لما يكون partial damage, there is a blunted roots, and when there is no damage to the Hertwig's epithelial root sheath, the roots were normally developed, respectively. Indeed, roots with odd shapes and blunted apices can be observed in some regenerative endodontic procedures. Damage to the Hertwig's epithelial root sheath can also occur due to trauma. احنا قلنا في بداية السلايد إن التروما هي سبب النكروسيس، وبالتالي وتحديدا السيفيريتي تبع التروما ممكن يكون هو اللي يؤدي إلى damage to Hertwig's epithelial root sheath زي الانتروجن والافالجن. طيب من ال limitation of regenerative endodontic procedures is the suboptimal barrier placement. كيف يعني suboptimal barrier placement؟ لاحظوا الصورة اللي في تحت. Challenge in regenerative endodontic procedures is the adequate placement of an MTA barrier over an unstable blood clot. احنا حنعمل bleeding من البري apical area حيدخل في الروت كانالز لغاية السيمنتو انامل جنكشن. Ideally, MTA should be placed in the coronal most part of the canal في أقصى مكان بعيد coronally. بس احنا شايفين الآن الصورة اللي تحت مثلا ال MTA تقريبا واصلة إلى الميد روت، وبالتالي الجزء الآن occupied by MTA will not undergo further development. The dentin thickness here will not increase because of the placement of this material. However, to avoid coronal staining, MTA is often placed below the cemento enamel junction or even in the middle third of the root canal. احنا الآن يعني MTA عشان ما يحصل ستيننج بسبب البليدنج وبسبب المينوسايكلين اللي موجود في التريبل انتيبيوتيك بيست، واذا كان تحديدا بنستخدم كمان جراي MTA وكمان الوايت MTA حتى في كيس ريبورت انه بيحصل فيها ستيننج، فبنحاول نبعد البليسمنت تبع هذه الماتيريال تحت السيمنتو انامل جاكشن عشان ما يحصل ديسكلاريشن في الكراون، وبالتالي هنا اخذنا جزء من الروت لن يتحقق فيه ال secondary treatment outcome which is continued root development. Coronal staining not only from the bioceramic material, also tooth discoloration is a common finding in ribs. This is mainly due to the use of minocycline containing antibiotic paste، وعشان كده احنا استبدلناه بالدبل antibiotic paste أو بالموديفايد triple antibiotic paste لما نشيل المينوسايكلين ونحط سيفاكلور أو أموكسيسيلين أو كليندامايسين. كمان ممكن نستعيض عن الانتيبيوتكس بكلها ونحط الكالسيوم هيدروكسيد as an intracanal medication. طيب هذا في حالة discoloration caused by medication. Discoloration caused by MTA either gray or white can be avoided by using of a biodentin or endosequence material, or those are all alternatives to MTA. Staining in regenerative endodontic procedures is not solely caused by the use of minocycline containing antibiotic paste. Mineral trioxide aggregate is known to cause significant staining. MTA has been used in the vast majority of the published cases. White MTA has been developed to be used in aesthetic areas. However, even the white form of MTA has been shown to cause significant tooth staining, particularly when positioned above the cemento enamel junction. This is due to time limitation I couldn't place all the case reports and all the pictures. لكن هذه لفتت نظري صراحة. Treatment of a large cyst-like inflammatory periapical lesion associated with mature necrotic teeth using regenerative endodontic therapy. أعتقد الإكس راي يتحدثوا عن أنفسهم. الtooth is completely mature, الroot is completely formed, there is a large periapical lesion, and the tooth was treated using regenerative endodontic procedures, and you can spot the difference from pre-operative radiograph and follow-up radiograph. The lesion healed and the patient is asymptomatic and the swelling has disappeared. شكرا جزيلا والسلام عليكم ورحمة الله وبركاته.